India, there have been more than 50 years of programming to promote the use of family planning methods. But the prevalence rate for modern methods continues to be low and the unmet need high.
किसी-किसी को सूट करती है, किसी को नहीं सूट करती है, इसलिए हम इस्तेमाल नहीं करते।
हॉस्पिटल भी दूर पड़ते हैं, हम बच्चों को छोड़ के हम कहीं जा नहीं पाते।
पता नहीं कितना महंगा लगेगा, ये होता है।
Women, they want a spacing, they don't want many children, but looking to our scenario, they have some hesitation. Even they are not able to talk to their husband also, very frankly. So it's a very big problem for them.
Historically, family planning in India has been driven by the need to achieve population stabilization rather than from the perspective of a woman's choice. For research says that when women are presented with choices, their willingness to choose a method increases substantially. DMPA, though used by more than 32 million women in over 175 countries and approved for sale in India since the 1990s, is not part of the basket of contraceptive methods available under the National Family Planning Program for a variety of reasons.
SHOPS, or Strengthening Health Outcomes Through the Private Sector, is a USAID-funded project which aims at engaging the private sector for public health outcomes. USAID has a long history of working with the private health sector. USAID initiatives, which include market-based partnerships for health, social marketing and social franchising, public-private partnerships, etc., are aimed at improving healthcare for base of the economic pyramid populations. Funded by USAID and initiated as a pilot in Uttar Pradesh in 2003, the Dimpa program improves access to and demand for depometroxyprogesterone acetate or DMPA through the private health sector. The program initially identified and built the capacity of obstetricians and gynecologists who are well positioned to impart quality care to potential DMPA users.
ट्रेनिंग जो उन्होंने की वो हम डॉक्टर्स के लिए भी थे, इवन हमारे पैरामेडिकल स्टाफ को ट्रेन किया। और पैरामेडिकल को स्टाफ को ट्रेन करना वाज मोर बेनिफिशियल, क्योंकि कई बार होता है क्लाइंट्स हमारे पास आते हैं, हम उन्हें ऑप्शंस देते हैं, वो लिटिल बिट कंफ्यूज रहते हैं, पर जब वो हमारे पैरामेडिकल से बात करते हैं तो वो शायद काउंसलिंग में ज़्यादा टाइम दे पाते हैं। और तब जो मैंने चॉइस देखी कि कई बार फिर मेरे पास पेशेंट्स डायरेक्टली आते थे कि दीदी हमें डिम्पा इंजेक्शन लगवाना है।
Quality of care is a critical element of the Dimpa program. It is client-centric and involves the client receiving comprehensive information on all contraceptive methods. As contraceptive use increases and becomes the established norm, we need to improve both acceptance as well as continued use of the chosen method.
Once the network was well established, the user needed to know what's in it for me. A No Bahana campaign was created to let consumers know how life with contraception is different from life without. The campaign across different media articulated a definitive tangible benefit of a method, 3 months anxiety-free sex life. The campaign generated an interest among potential users, and to support and address specific queries, the Dimpa helpline was set up. With a high level of telecom penetration, a helpline came as a very effective method. The communication campaign promoted exclusive helpline numbers for men and women and filled the gap between awareness and action.
With access established through the Dimpa network, the next challenge for the program was to increase availability of DMPA in the project areas. The Dimpa program's advocacy efforts with marketeers and distributors resulted in DMPA being available at different price points. By the end of the SHOPS project, there was a seamless supply of DMPA at both service delivery points and chemist points.
The network, outreach, helpline and new brands established access to DMPA. But within the family planning context, the race is not won until the consumer continues with the chosen method. The Dimpa Care Line is a telephone-based post-use support mechanism.
SHOPS focus on increasing satisfaction among DMPA users, thereby leading to continued use. As the users are dispersed among the population, SHOPS used a telephone-based counseling service called the Dimpa care line to reach them.
The consumer gives a missed call to the care line and counselors connect back via a series of free outbound calls. The counselor lessens the couple's anxiety by listening to the user describe what she is experiencing and indicating if the side effects are normal or warrant a visit to the provider. The counselor also calls the client to remind her of the next dose.
The care line addressed the concerns of women using DMPA, including its side effects. It complements the efforts of her provider to encourage continued use.
The Dimpa program has shown how one can grow a relatively less known category of contraceptives using a network model as an entry strategy.
The Dimpa program demonstrated how a new method could be introduced into the basket of choices. The SHOPS project established that if mHealth is applied effectively, it has the potential to improve satisfaction and thereby continuation among family planning clients.
The idea is to provide choices to individuals with sensitivity and careful thought to make their own reproductive health choices that are free from discrimination, violence and coercion. The result? Significant increase in the use of DMPA among currently married women aged 18 to 49 years, and DMPA on the threshold of being a widely accepted method.
जितना ज़्यादा मुझे चॉइस मिलेगी उतना ही चुनने में मुझे बेटर होगा। मुझे ये लगेगा हाँ ये चीज़ मेरे लिए ठीक है, और फिर हम दोनों लोग मिलकर आपस में हस्बैंड वाइफ मिलकर के ही कि हाँ ये चीज़ हमारे लिए फैमिली के लिए अच्छा है।